Mike Leavitt is the Secretary of Health and Human Services. And when he was governor of Utah and got the call from President Bush and was told he was going to come to Washington to be the head of the Environmental Protection Agency, he called his insurance company and he said, I have sleep apnea and I've been using a machine for the last 6 years to take care of my ability to sleep at night, and it's pretty well worn out. I need to buy a new machine, but I'd like to buy 2 of them because I'm going to travel a lot in my new job, and I'd like one to stay in my suitcase. And the clerk said promptly, well, you know, we don't actually sell you the machine for the first 3 months. You have to rent it to prove you'll use it. And he said, wait a second, I just told you I've been using one for 6 years. I'm not renting one. They said, well, okay, but we're not selling you 2. We'll sell you 1. And it costs $950. Your copay is 20%. You'll pay $190. You have to go buy the second one yourself. So Leavitt, who's a pretty smart guy, goes on the line, finds exactly the same company with 2 of these machines for $750. My copay is $150. You save money, I save money. He said, nope, can't do it. It's $950. You pay $190, and you buy the second one yourself. The next thing Leavitt did is send a letter to the chairman of the company, or the CEO of the company, saying, I would like you to understand why I have dropped your insurance and go into a health savings account, because this is a level of stupidity I don't want to pay for. That's the story he told me when he first became Secretary of Health and Human Services. I was with him 2 weeks ago in Georgia with Governor Perdue, and Leavitt was announcing a project of values-based competition and requiring the right to know price and quality and giving people knowledge about what's going on. He told them this news story. He and his wife just turned 60. And he decided as a precautionary step that he would get a colonoscopy and she would get a colonoscopy. So he decided he would try to do what citizens should do. And he began to call around for an episode of care. And he found out in a particular Washington hospital that if you went in with Dr. A, you could get a colonoscopy for $6,700. But if you went into the same hospital to the same room with the same machinery, you could get a colonoscopy for $5,700. Then he thought, I'm from Utah, and Wenberg at Dartmouth has said that the least expensive high-class hospital in America is Intermountain Health, so I'll call there. So he called Salt Lake City. I said, oh, our standard price is $3,300. So Leavitt and his wife can fly home to see the grandchildren, have the procedure, and save $2,000 each. Now let me go a step further. Congressman Paul Ryan, who's one of the brightest younger members of the House, announced in Milwaukee at a hearing last year that for one particular procedure in Milwaukee, inside the metropolitan area, the difference in price was from $46,000 to $123,000 for the same procedure. Almost 3 times as much.